Science thrives with diversity of inputs, opinions, thoughts, and that comes from a scientific community that itself has diverse backgrounds. The real-world consequences of the lack of diversity is really an impact on the types of scientific questions that are asked, the range of approaches that one might take to address a particular scientific question.
In the absence of diverse voices, what gets asked in terms of scientific questions are the questions that the individual investigator has the curiosity to look at. We can all remember what happened with HIV. Individuals who were having the heaviest burden of HIV incidence, which is the gay population, were not in positions of power, and they were not the scientists.
I think it's definitely been an ongoing challenge to make sure that the science research that we produce is actually based on an inclusive community of individuals.
SF Build is a project that's funded by the National Institutes of Health that partners San Francisco State, which is a minority serving institution, with UCSF, which is a Tier 1 institution. SF Build is, at its core, a research project. The hypothesis is that if we create affirming and inclusive environments, we will change who gets included in science and how it's practiced. The overall goal is to enhance diversity of the biomedical research workforce. In 1968 and 69, the university closed down for nearly 6 months as a result of students basically getting fed up about the fact that they weren't seeing themselves in the faculty, they weren't seeing themselves in the curriculum and in the content.
There's a strike going on here, and that means that classes should not be functioning.
Because of that strike, a lot of things changed in this country. Higher education was much more directed towards people of color.
It's an important opportunity each time these acts of resistance occur for us to engage in critical self-examination and ask the kinds of questions to push us to say, how can we be doing better? Institutions of higher education are increasingly becoming far more diverse than they were 10, 15, 20 years ago. It's important that our teaching methodologies and the ways in which we engage our students in the classroom, particularly in science and math and technology, changes to adapt to the fact that our students come with so many different learning styles and so many different life experiences.
The way that SF Build extends the legacy is that we're trying to move the idea of research by people of color, with people of color, for people of color, to do the same for science and biomedical research.
The thing that's really exciting about SF Build is the opportunity to focus on the institutions, the way we make our environments more encouraging, environments that really not only attract students to science, but also help retain them.
SF Build is governed by the SAFE model. The SAFE model describes a multi-level approach to work with students, faculty, and the institution to change the contextual environment so that it's affirming and inclusive of everyone. So in the Health Equity Research Lab that I direct, there are affirming messages all over the walls, and even the pieces of equipment have affirming words on them.
We have worked in SF Build to train our faculty on areas of stereotype threat and implicit bias.
The biggest thing is we actually have implemented new hiring practices to have more faculty of color, because we know that numerical underrepresentation triggers stereotype threat, and that students really feel more included in a particular domain if they see faculty who look like them.
They're missing seeing themselves as professors and seeing themselves as PhD scientists. And that really limits their perceptions and limits what they think that they can do. What makes our program a little bit different is we're really focusing a lot on this identity piece and how do we help students develop this identity as a scientist, an identity as a leader, an identity as a change maker to affect your own community and do science in a way that's going to affect your family and work on projects that are personally meaningful to you.
I was the first person to go to college from my family. I'm from Tijuana. Me and my family migrated when I was 15. When I decided to go into science, I learned about how stress response and specific events in your life that could be very traumatic could have a huge toll on your health. Growing up in Tijuana, you live this life of fear. I realized how these experiences were affecting my community. I really wanted to do something about it. I really wanted to be that voice for those people coming from that community. And then that kind of like sparked my interest in the brain.
What we're trying to do is connect the desire of the student to give back to their communities in a meaningful way through science and the need that UCSF has for individuals to participate as researchers, clinical trial managers, lab staff in research projects on the communities of color.
At the beginning stages of my college career, I would talk to my professors about trying to do research, and they would say, you know, you have to do all volunteer, not knowing that tuition's way more expensive now, that I was a minority and I was helping out my parents as well. They could really see themselves in me, and I couldn't compare myself to them either.
Traditional student training programs in the sciences have focused on student deficits. They came from poor families, so they have to get money as part of the training program. Their parents are not college graduates, and so they have to be introduced to individuals who are college graduates and role models and that sort of thing. Instead of focusing on student deficits, we decided to focus on leveraging student assets. SF Build did is said, let's think about the assets. Kinds of capital that students come in with. Social capital, the communities they come from and the connections that they have. Linguistic capital, many of our students are bilingual. Aspirational capital is, I can do this despite barriers. We have a lot of aspirational capital in our students. We want to harness all these capitals, community cultural wealth, to benefit the practice of science so that we actually can do the research that needs to happen for these communities so that we can eliminate health disparities, for example, and bring about health equity.
SF Build helped me find a safe space where I could be myself. I could talk about science. I could show my Latina-ness. SF Build also provided some income coming from a place where I was learning.
It's really fantastic that we can provide these opportunities for students to work and bring their own personal experience, their own lived experience into the research and help inform that research, because in many cases, their experience is not necessarily in the research.
People don't understand that we've been researching science and medicine the same way for the last hundreds of years. We keep recruiting the same kind of people, and these people are not diverse. They don't suffer through the same things. And we keep putting that, that shoe of health on the wrong foot. I want to make sure there's all these shoes built for the people that come with all these other feet.
Most innovative part is the fact that giving back in terms of the research questions that are asked, in terms of tutoring others, near-peer mentoring, all aspects of the Build approach is going to improve persistence of underrepresented groups in science so that they actually become the agents of change that make the practice of science benefit more individuals.
SF Build's professors show their diverse backgrounds. It really erased that gap and allows me to understand that I could get to where they're at, or even further, that there's really no limit. They are also teaching us what the real issues are and how we can be part of the solution. Working in the lab, I seek those opportunities for giving back to my community. Now I'm working in genomics and computational biology because I feel being part of biomedical research could really help minimize health disparities.
There are people that are pursuing science, that are pursuing research, that they would never have had SF Build not been here. These students that are applying to SF Build are different students than are applying to our other undergraduate research projects. These are students that really are drawn to the mission of SF Build, of doing research to benefit their community and benefit society, that are working on transdisciplinary projects between Parks and Rec and epidemiology, that are working on projects that really are very impactful but take a team of people to come together. As a result of SF Build, we have different research that's taking place.
In SF Build, we're actually collecting the data that shows that once you have more historically underrepresented individuals on science teams, you ask different questions, you ask them better, you get better answers, and the results get disseminated to the communities in a more effective way. We are following the scientific method in a rigorous fashion, using a transdisciplinary team to look at our theoretical frameworks, to look at the experimental designs that we are using, to look at the data that we're collecting and how it's being analyzed, and to basically note how creating an environment that is affirming and inclusive increases the persistence of historically underrepresented students in fields that lead to biomedical research careers.
The foresight of the NIH to invest in this type of model, I think, is really quite powerful, and I'm looking forward to more sort of creative strategies to address the goals that we all share.
The power of SF Build will be, how do we help spread that knowledge, and how do we make sure that this is infused into all areas of the campus in a way that's sustainable, efficient, and manageable? We want to make sure that we address those core needs for our students and give them the opportunity to achieve every single one of their educational and personal goals that they have for themselves, for their families, and for their communities.
My hope for SF Build is that institutions change the face of science, change the practice of science, change who benefits from science. And so that's why it's important to have the agents of change that we're creating.